Welcome to Kidney Talk, a program of Renal Support Network, a show that streams health, happiness, and hope to the kidney community. You can download all Kidney Talk shows from iTunes and find a variety of resources to help you navigate this illness at rsnhope.org. Please welcome your host, Lori Hartwell, who has lived with kidney disease since the age of 2.
Well, welcome to Kidney Talk. Today we have a wonderful nephrologist named Dr. Richard Johnson, and he's one of the founding editors of the specialty textbook Comprehensive Clinical Nephrology, which is one of the most popular textbooks for the field of kidney disease, and it's now in its 7th edition. He is both a clinician and a researcher and has studied the cause of treatment of chronic kidney disease for several decades. Dr. Johnson lives in Colorado with his wife, kids, and 2 rambunctious puppies. So welcome to the show, Dr. Johnson.
Thank you. It's a delight to be on your show, Lori.
I'm excited to learn more about Renadyl and gut health. So tell us, what does the bacteria in our gut do? I mean, we just kind of learned that. We kind of took our stomachs for granted up until, many years ago.
That is so true. And that's true for everybody, including the physicians. For years, those of us who studied kidney disease, we just focused on the kidney. And we didn't really think that bacteria in the gut could have a role in kidney health. And, we've been aware for years that diseases of the gut can affect people with kidney disease. And, that you can have situations where you can have a bad infection that causes diarrhea or colitis, and it can require hospitalization. And, we're well aware of bad bacteria ever since the days of cholera. But we really haven't thought about the gut as having healthy bacteria, a bacteria that actually might promote good health. And probably around 1980, the first studies started coming out suggesting that the gut bacteria actually can influence our overall health. And the way it can do it is several ways. It turns out that the bacteria in the gut are quite diverse. And there's some that produce good factors that can promote health and that can get absorbed through the bowels into our body. So these bacteria will produce things that actually tend to keep our blood vessels dilated and healthy, that can help reduce cardiovascular events. And there are also bacteria that can make bad things, and some of them are very long and complicated names like TMAO and indoxyl sulfate and cresyl sulfate and all these different things that even us doctors don't really like to try to memorize. But these products actually can be bad. Some of them can actually increase the risk for blood clots or heart disease, and others can cause oxidative stress, which is, kind of a term meaning that, that you're actually can get some inflammation and damage to your organs. And so we became aware probably around by 2000, it was pretty clear that bacteria in the gut could make a difference. And people were already experimenting. And for a while there were foods like yogurts contain yeast and contain bacteria like lactobacillus. And it was known that people eating yogurt could help a healthy gut. And I remember, maybe around 1995, people writing that, yogurts could help people after they suffer from a diarrheal illness because it can help repopulate
bacteria.
Yeah, repopulate the gut with good bacteria. Yeah. So we started, understanding that there was this relationship between the gut and health, but in terms of the kidney, we kept thinking the kidney was pretty separate from the gut. And then started maybe 10, 15 years ago, people started studying the gut bacteria in people with chronic kidney disease, people on dialysis, people who are nearing dialysis, and people who just, have an elevated creatinine or have what's called chronic kidney disease. And they found that the gut bacteria were not completely normal, and that there were an imbalance where there were more bacteria that were bad guys that were making stuff that was bad. And so people gave it names like doctors love to give complicated names. So we called it dysbiosis, which just means, that the bacteria had been altered to kind of a sick bacterial type.
It's always interesting to me because I think we're learning how many bacteria is there. There's millions of them, right?
Some people say there are billions and
There's
even
billions
a trillion, like a trillion.
I mean, it's just kind of weird to think about all those little suckers swimming around in my body, but they become evident. I've had to take a lot of antibiotics, and I always worry about that because when I take antibiotics, it does kill some good bacteria that I might have.
Yeah.
So I'm always a little bit more because the good bacteria help you process the foods, right?
Right. Yeah, there was it was shown a long time ago when I was a medical student. There was this discovery that drugs like ampicillin, which is an antibiotic commonly given, can cause diarrhea, and sometimes it can be associated with a really bad diarrhea with blood and everything in it, and it got the name of basically antimicrobial induced colitis. And then they discovered that there was an organism called Clostridium difficile, or C. diff is its nickname.
Yep, I know that one.
Yeah, and C. diff. Everybody who's gone to the hospital has probably heard about C. diff, because when you get antibiotics, if you happen to have a little bit of C. diff in your gut, it loves antibiotics because the antibiotics tend to kill its buddies, its enemies, I guess, and allow the C. diff to grow. And when the C. diff grows, it causes terrible diarrhea, and it's so infectious that once they carry the C. diff, doctors have to be super careful, because just even touching the blanket you can get the C. diff on your hand and without knowing it, and spread it to the next room. So whenever we have a patient with C. diff, they go into isolation. We have to wear gloves, and we have to wash our hands extensively even after we take the gloves off.
Wow.
So that's a great example of a bacteria that causes bad things. C. diff, it can kill you. I mean, if you can burst, you can rupture the colon, you can get a perforation because it causes
a nasty little sucker.
Yeah, it's a nasty guy.
Little sucker. Well, and I became interested in bacteria many years ago because there was a TED Talk called How Bacteria Talk. And it was really fascinating because the bad bacteria talk to each other. And in this one species of animal that's in the ocean. And once they take over the host, they all talk to each other and say, okay, attack, let's make that person sick, or let's take it down. And it's like a little war going on. So you gotta be prepared and have your ammunition of good bacteria. You gotta build up your little military.
And there was in the history of humanity, in the history of life, there was one type of bacteria that got into the body, not just in the gut, and it turned into the mitochondria. And we now know that the mitochondria more or less derived from an exogenous or from a bacteria, and somehow got into our system, and it's passed. And mitochondria are good; they produce energy. So there's an example of a great bacteria.
Good bacteria.
Yeah, but there's a lot of bad bacteria. Anyway, the bottom line is we learned that chronic kidney disease is associated with bad bacteria. And so I have a little story about this because I've been doing research since 1980.
A long time.
Yeah, a long time. I don't want to admit how long it's been, but it's been a long time. And I've written quite a few papers, and I became kind of well known in the field of kidney disease. And when I would go to the national meetings, I would try to figure out who was doing new stuff so that I could meet with them. And I met a tall guy from India named Rangan. Actually, it was Ranganathan, but his name everyone called him Rankin, and he was a microbiologist who was wandering around at the kidney meetings. Now that was a time when microbiologists weren't walking around the kidney meetings. And so I was curious what his desire was and what his thinking was. And he said to me, I want to generate a probiotic, a capsule of good bacteria that I can give to people to help them with their chronic kidney disease. And he was truly the first one to talk about this. And so I became very interested in him, and he and I became friends, and I tested some of his capsules in animals, and I became convinced that this is a real story, and that if you can improve the gut bacteria, you can make healthy things, and the bacteria will make healthy things that you can absorb. So the first idea was just to try to replace the bad guys with good guys. And in so doing, the good guys will make stuff that are good for health and will remove the bad. And so this was the original thinking. And one of the big areas where we were learning that the bad bacteria worked was that they would basically cause low-grade inflammation in the lining of the bowel. And that would lead to things that normally wouldn't get absorbed could now get across. And, good examples of that is gluten. Gluten gets into the blood because of a leaky gut, because the gut's leaky. And then you develop gluten allergy and celiac disease. But you wouldn't get that. You wouldn't get that if the gluten didn't get into the blood. Just like there are all
that's
these
interesting.
Yeah.
It's just, it is pretty amazing because, so let's talk a little bit about Renadyl, because Renadyl's been formulated for the gut health of people with kidney disease. And
Right.
you buy it over the counter, right? You don't need it's good to always get your doctor's opinion on anything you take.
Absolutely.
But you always got to talk
I'm
to your
a doctor. I approve that suggestion.
Yes. And so, does Renadyl have special bacteria or help with which good bacteria, or have a favorite bacteria it likes to promote?
Yes. So what Rangan did was he said, okay, look, I'm going to try to replace the bad with the good. And there are general bacteria that are bad, and there are general bacteria that are good. And so many probiotics have the good bacteria. And so this general principle is true for all probiotics. You kind of put in good bacteria and you don't put in bad bacteria. But he went one step further. And this is why he's especially I'm interested in his. And that is, not only did he replace bad bacteria with good bacteria, but he decided that there was another potential benefit probiotics might do. And that other benefit is to actually degrade creatinine and BUN and uric acid and all these things that kidney patients retain. So when you're in kidney failure, or if you have kidney disease, your kidneys are having trouble excreting certain types of ammonia products, urea, etc. And when they build up, they cause some of your symptoms. So when you go on dialysis, it's to help remove these bad guys. And what Rangan said is, why don't I find bacteria that actually eat up these bad guys, kind of like little Pac-Men, and they will eat up the creatinine and the uric acid. And that would be another way I could help the patient with kidney disease. In other words, we're not just replacing bad bacteria with good bacteria that can block inflammation, et cetera, which is great. But we can have a second gain in that we can pick bacteria that will degrade creatinine, degrade urea, degrade uric acid. And so that's why his probiotics are different from the others.
Well, you know what? One of the things I think is interesting is that before I went on dialysis again, and my third kidney was puttering out, that I had this very strong taste in my mouth. And it was probably the different acids in my stomach, because I felt like bleh, my mouth just felt so unnormal, like, things didn't taste the same.
Yeah, ammonia. By the way, that's produced by a bacteria called Heliobacter.
Oh, well, I had a lot of those.
There you go. That's another bad guy. Yeah.
Yeah, so does Renadyl eat that little bacteria up?
So the way it does is it really doesn't eat bacteria, but it
Oh,
it
okay.
blocks what the bacteria make.
I get it. Yes.
And I'm not certain if his Renadyl does that, but his Renadyl does degrade uric acid, which is one of my favorite bad guys. I mean, bad guy shouldn't be favorite, right? One of my loathsome bad guys is uric acid.
Isn't uric acid create gout?
Yeah, uric acid creates gout, but it's also does a lot of other things. It increases the risk for heart disease and kidney disease and many others.
It's not a good guy at all.
No. It's got a black cape and it's wearing a black mask and it goes out only at night, and it really is aimed at trying to not do good.
Well, and also too, when you have kidney disease, your diet changes a lot, and it's not all the healthy food that's on it when you have high potassium. So when you risk at potassium, so your diet does change a lot when you have kidney disease, and it's really hard to sometimes, you have to eat more protein, and you're like, well, steak's not the best choice probably.
Right.
So we're learning a lot about food.
Yeah, you sure are.
So are there any side effects of Renadyl?
The only ones that I'm familiar with are that sometimes people have a little bit softer stools, and some people actually like that because, if you prone to constipation, for example, it's probably a benefit to have this one.
Well, yeah, I remember being on those fluid limits and taking certain medication that caused it. And so is there evidence? Is there different things that support its effectiveness? And tell us a little bit about that.
Yeah, so we tried it in animals, and it definitely helped the animals. It reduced blood pressure and improved kidney function in animals with kidney disease. So we were pretty excited about what it does in the mouse or the laboratory rat that's with kidney disease. And Rangan decided to do a big clinical trial in people with chronic kidney disease, and he did a number of pilot studies, including in dialysis patients, and the results were encouraging that it could block inflammation and slow kidney disease. So he took on a very big study, which was meant to be several years, and it only lasted 6 months because he actually got ill and ended up passing away, sadly.
Oh, wow.
And so the study was never finished. But the guys came to me when they analyzed that first 6 months of data. And that first 6 months of data, and this was a placebo-controlled trial, definitely showed a signal where the people who were getting the Renadyl, their kidney function was better than the controls. And they were losing kidney function at a slower rate. It was helping them. And it was significant. But the differences were relatively small, but it was significant improvement. And but I think it's hard to show a big effect in just 6 months. Usually it's takes several years. So the way I view it is that it looked very, very promising, but not definitive. So in my recommendation as an expert on kidney disease, it would be the following. There's a strong argument for that it should be beneficial. There are many people who definitely believe that it's helping them. And the data shows a statistical improvement when you're on this, but it's not a huge one in the 6-month trial. So my feeling is that if you wanted to try it, what I would do is I would kind of measure your kidney function, have your doctor measure it, get his approval to go on it. I don't think he would say no because it's only good bacteria, and it's a probiotic. It doesn't really have any negative effects or side effects. Take it for 6 months or take it for a year and see if it helps you. See if you feel better. There are definitely reports from some of these trials of people feeling a lot better, of less inflammation, of improved kidney function. So my belief is that it's going to help a lot of people. It may not help everyone. Maybe you already have healthier bacteria than you think you do. Maybe you're one of those kidney patients who's really eating healthy and doing everything right, and your bacteria are already good. I don't know, but maybe not. And so if it's something that I don't know how expensive it is, actually. I do not know how expensive it is, but I think that it's probably worth a try. And I know that the Renadyl people are interested in supporting and helping people. So
it's interesting. I mean, you could get it at Amazon, Renadyl, Walmart. You could get it at a bunch of different places. And I did see that Renadyl gives a 90-day money-back guarantee, which was nice. And so also we missed this part, but it's good for individuals with stage 3, 4 kidney disease, transplant recipients, and can have some benefit for people on dialysis. It doesn't have any negative effect because you just void it out, right? So it has no impact on that. And then, I mean, the price is about $70 for 60 capsules. So it can be a little bit cheaper, as they're offering a code today, RSN15 at renadyl.com, if you were to make a purchase from this podcast. But also, it's so crazy now because insurance isn't paying for anything. So I can't imagine they would pay for this.
Yeah, I don't think so. I don't think they would, but you never know. And the world is changing, and there's more and more emphasis on preventive strategies and healthy dietary moves. And so there may be a day when it is covered, but right now it's not.
Well, and it's interesting because of the fact that, when my stomach or I feel a little heavy or my gut feels a little weird, I feel more tired. I know that very much about myself, like I'm like, just not great. It's usually has to do with my gut because especially being a long-term patient who has had kidney disease, I've had a lot of surgeries and I don't have a lot of room. You know what I'm saying? Like,
I tell you something. It's really true. Gut health, like if you've had surgeries and you've been in the hospital a lot, the gut bacteria probably aren't that healthy. Keeping them healthy is probably a really good move.
Well, eventually they need a blood test that says your gut health is healthy. That's what they need, right?
Yeah, they do. Right now we can tell, but we have to do all these fancy molecular biology PCR
can't you just spit in a cup? Can't you just spit in a cup like a urine test?
Then hold it up to the light and see if you can see through
bacteria. And I bet you.
If it's yellow, it's bad. If it's clear, it's good. Well, I wish it were that easy. I wish it was that easy. But
I encourage everybody to listen to the TED Talk, How Bacteria Talk, because it was fascinating. And I became interested in bacteria after listening to that video and understanding how when I take antibiotics, I produce a lot of bad bacteria as a result of it. So I have to be extra cautious. Well, anything in closing before we wrap up?
I tell you, I love taking care of people with kidney trouble. I love the kidney patient. I wish you all great health going forward. Talk to your doctors. Make sure you're eating well. Get your blood pressure and blood sugars good. And and with all these new medications that are coming out, we're really seeing some great advances in kidney disease. So
it's exciting. There's a lot of knowledge, and the best thing, somebody who's lived with this illness for I can't even believe it, 56 years. Can't believe I'm saying that. Knowledge is power. The more
knowledge is power.
It really is, and you need to do all your homework and ask your doctor questions because it's life-saving, and we're a partner in care. So it's important for us to do our part. Well, thank you so much. I really appreciate you, Dr. Johnson, and I love that you have rambunctious puppies, and that's the second thing that'll make you feel better is having a
Yes,
puppy.
yes, dogs are wonderful. My
Yes, they
puppies
are.
are now a little bit older, but they're like 3-4 years now.
Oh, they're always puppies to
They
us.
think they're puppies. Yeah, they
Mhm.
definitely think they are. All right. Well, thank you very much.
Thank you so much. Have a great day. Bye-bye.
And to you. Bye-bye.
Thanks for listening to Kidney Talk, a program of Renal Support Network. Please make sure to find us on Facebook or sign up for our newsletter at rsnhope.org. Kidney Talk is intended for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your physician. Always seek the advice of your own healthcare provider regarding your medical condition.